Hi, I am Anton Peleg. I am the Director of the Department of Infectious Diseases at the Alfred Hospital and Central Clinical School, Monash University. I also am a research group leader at the Monash Biomedicine Discovery Institute, running a superbug pathogenesis and mechanisms laboratory. And I am the Infection and Immunity Theme Leader for the Monash Partners Academic Health and Translational Research Centre through Monash University. My area of research in infectious diseases really focuses on superbug infections or infections caused by antimicrobial resistant pathogens, as well as hospital-acquired infections, and how we can best prevent, treat, and detect these infections within the hospital system. I think there are amazing new technologies that we are only now starting to adapt to help us with our research and the translation of this research into healthcare. And examples of this include genomics and how we can understand the genetic fingerprint or the genetic code of bacteria and superbugs to understand their mechanisms of antibiotic resistance, as well as their virulence mechanisms and how they cause disease. We also have new emerging areas such as machine learning or artificial intelligence that we are now starting to adapt and use to better detect and treat superbug infections. And finally, there's now a wealth of digital health data, such as electronic medical record data on patients. So we're having the highest resolution of information exactly on this patient and the exact bug that's causing their infection. And we can process all this information for very personalised therapeutics for best outcomes against superbug infections. One specific breakthrough moment in our research is when we were looking at golden staph and how it leads to resistance to antibiotics. But we also noticed it led to resistance to our host immune system. And so it led to persistent infections when it became resistant. It was almost like a double whammy. When we looked at the mechanism of that, we were completely surprised to find that it was a single mutation in a gene that encodes some of the surface characteristics of golden staph that led to all of these vast changes. And that single change in the gene led to a one amino acid change in a protein that changes all the surface characteristics of golden staph, which allowed it to simultaneously be resistant to an antibiotic as well as the host immune system attack. So this was an amazing finding and something that we are now working on very closely to try to develop therapies that prevent golden staph from being able to evade antibiotics and the host immune system and make it more susceptible to these attacks so we can clear infections in a much better way. I began my interest in superbug infections when I just started my infectious diseases training, and I was looking after a patient on the ward who was a young patient who was being treated for their cancer. And what happened in a very short period of time, specifically like overnight, they became very unwell, very high fevers, their blood pressure dropped very low, and despite all efforts to try to resuscitate them, they passed away. And this had a lot of impact to me about, they were young, it was a terrible scenario that they had an underlying cancer, and then they developed a very severe invasive infection. And 2 days after they passed away, the blood cultures that were taken from that patient flagged as positive with a superbug. And that superbug was resistant to almost all antibiotics. She had an overwhelming infection from this. Her immune system was obviously not right because of the chemotherapy she was receiving. But it made me think that these superbugs are here. This is a reality. And I want to spend a lot of my research career focused on how to better detect them in a faster way and how to better treat them so that that scenario doesn't happen to future patients. Our research, is really striving to look for new therapies and alternative therapies that we can use with antibiotics or on their own. Look at ways that we can prevent superbug infections and try to understand how superbugs are spread within the hospital system and how better to track them so that we can stop them in their path for spread across patient to patient. So we're sort of looking at the full spectrum and continuum of research from basic mechanisms all the way to implementation research. I think Monash has been an amazing place to do our research and have our research activities, because not only do they have world-class laboratory research environment and platforms that we utilise, there's amazing collaborative aspects to it and amazing other researchers to team up with for an interdisciplinary program. So that connectedness is something that is really valuable for my research and for others moving forward, so we can actually turn some of our findings into actual impact for patients and their lives and improvement of life, as well as survival from some of these nasty infections.